Thakur, and today I am going to present the effect of leiomyoma on pregnancy. Today I will be telling you effect of leiomyoma on early pregnancy, late pregnancy, on labor, purpurium, and also the effect of pregnancy on the fibroid. First is effect on early pregnancy. There is infertility or implantation failure, especially in the submucosal type of fibroid. Then early abortion, that is miscarriage, can happen due to poor blood supply or distorted uterine cavity. Bleeding in early pregnancy can happen mostly in the first trimester because there is defect in the implantation of placenta. Then there is pain due to degeneration. In this ultrasound, you can see that there is a gestational sac and embryo within that, and then there is a fibroid in the uterine cavity which is nearby. And important point to note here that the gestational sac is separate from the fibroid. In this ultrasound, you can see the intramural fibroid within the uterine cavity. In this, you can appreciate that there are multiple fibroids are present. Then effect in late pregnancy, there is an onset of preterm labor due to fibroids. Then malpresentation, that is breach or transverse lie. It is due to distortion of uterine cavity. It leads to increased 8-fold risk of difficult cesarean sections in pregnancy. Then there is IUGR, it can happen rarely, and then there is placental problem, that is placenta previa, which is the low-lying placenta, and abruptio placenta, means placenta lies in the upper uterine segment, but there is bleeding from the normally lying placenta. Then the effects during labor, there is obstructed labor. If fibroid is present in the lower uterine segment, then there can be prolonged labor or dystocia. Then insufficient uterine contraction in strength and frequency, and then there is non-engagement of the presenting part. The biparietal diameter of the fetus, it is not able to get placed in the maternal pelvis, that leads to non-engagement of the presenting part. And then there is effect in purpurium, so it leads to postpartum hemorrhage due to uterine atony. It can also lead to secondary PPH, that is excessive vaginal bleeding after 24 hours of the delivery of fetus and placenta up till 12 weeks of delivery of the baby. Then there is subinvolution of uterus, that is the uterus is unable to shrink to its pre-pregnancy size after 6 weeks of delivery. Then retained placenta can happen. There is increased risk of infections. And leukometra is a abnormal collection of pus in the uterine cavity, and pyometra, it means the uterus is filled with pus and bacteria. In this USG, you can see the postpartum fibroid with degeneration. So after delivery of the baby and the placenta, the fibroid here undergoes degeneration. It is due to after delivery the blood supply of the uterus decreases, which leads to ischemia, and then it further leads to degeneration of the fibroid. Then the effect of fibroid itself due to pregnancy is most commonly is red degeneration. Then there is torsion, especially in subserous pedunculated fibroid. So the fibroid is connected to the uterus with the help of a stalk, and if there is a torsion or twisting in the stalk, then the blood supply to the fibroid decreases, and it leads to sudden severe abdominal pain, and reactive peritonitis can also happen in this. Then the size of fibroid, many fibroids they remain stable or they shrink, but 20 to 30% of the fibroids they increase in size, especially in the first trimester, because in pregnancy there is increased levels, surging levels of estrogen and progesterone. Then there is red degeneration of fibroid. It is also known as carneous degeneration. It is a type of degeneration of uterine fibroid characterized by hemorrhagic infarction due to vascular compromise. It is very common in pregnancy, and it is especially seen in second and third trimester, and it is more common in large fibroids which are more than 5 cm in size. Gross appearance of the red degeneration of the fibroid, it shows red and beefy appearance, which is known as raw beef appearance. Then there is soft in consistency, and there is fishy odor due to fatty acid. Then this is the specimen of red degeneration. Here you can appreciate the raw beef appearance, and it is due to lysis of RBCs and hemoglobin. Also you can see it is soft in consistency and fishy odor is present. Thank you.